My view is that I do not support the tuition increase. I think it's unfortunate that it came along at the time that it did. President Hamilton is leaving the university system after a long time at the helm, and I believe he should have left this chore for his successor to let him grapple with it. My view is it could have waited. There's no crisis in the university system. It does, though, lead, some of the answers that you've gotten lead back to some of the work we did this year in Juneau to try to help the sort of general economic landscape of UAA. We have been funding you fairly strongly over the last few years. We bought a new integrated science building here. We bought a nursing building here. You're going to get funding for $37 million worth of deferred maintenance. It's long overdue. We tried to pass a reasonable balance between needs-based and merit-based scholarships. The Senate passed a bill of $7 million for merit, $3 million for need, and the House turned their back on that. That's unfortunate. I thought that was a fair compromise to the governor's plan. We tried to provide a little bit of both. We have also taken steps to make these buildings more efficient. Mr. Walker's right. We need to do that, and we did in SB 220. Passed a bill that mandates that state buildings can now be retrofitted for weatherization, the so-called low-hanging fruit that you have to address when you're making state buildings more efficient. So, my belief is that this university is the economic engine that drives you forward. And Ethan's right. If you look at the center of every strong economy, you've got a powerful education system pumping out intelligent young graduates, intelligent people to take your economy to the next level. So, folks who say the budget's too big, well, should also address what they plan to do with the UAA budget. I believe we should put more money here. And we put our money where our mouth is. The governor's budget came in at a certain number for the university. We added $433,000 on top of that because we believe that it's necessary. And thanks so much.
Thank you, Mr. French. Mr. Samuels, would you like to take question number 2? The state of Alaska just joined the lawsuit filed against the federal government for constitutional concerns over the recently passed health care reform. Do you support the Alaska Attorney General's position? Why or why not?
Yes, I do. And what I believe to the federal government, whether or not you agree with health care or No Child Left Behind or EPA regulations or whatever it is, the kind of heavy hand of Washington, D.C. comes into Alaska and starts affecting your day-to-day lives, what I believe is we are perfectly capable as Alaskans of making these decisions ourselves. If we want to have health care, then elect people, that's the goal to have. If we want to redo with No Child Left Behind, then that's what we should be doing. We should be pushing back on the federal government.
Thank you, Mr. Samuels. Mr. Berkowitz.
I think that suit is just pretty good theater, and I've been around politics long enough to know that oftentimes lawyers for the government engage in theater rather than what's good lawyering. And I posed the question when it was first raised to me, this is great that they've got this theater going, but who's going to solve the problems of health care? What substantive idea did Sean Parnell put forward to answer the needs of the 120,000 Alaskans who aren't receiving the health care they got? Because he didn't do anything. He just got there and postured. Now, folks might argue about the merits of the lawsuit. I think it's kind of frivolous. I thought it was interesting that they dismissed the lawsuit against the cruise industry the same week they launched against the federal government. I note the irony that the same folks that champion the cause of tort reform are very quick to file something in court when it suits their own interest. But we've still got to grapple with the issue of health care, and that's what hasn't happened. We didn't do anything over the last couple of years to make sure small businesses could pool together and buy insurance. We didn't do anything to allow people to buy insurance over state lines. We didn't do what the health care bill gave us the opportunity to do, which is to create a health care plan for the entire state. So I see this as just being political theater. It might have been acceptable lawyering, but it's really lousy leadership. Really lousy leadership. Because the people are stuck with the same problem afterwards. Whether Sean Parnell wins this lawsuit or whether he loses it, people don't have the health care that they ought to have. Now that doesn't make us freer, it doesn't make us more secure, it doesn't fundamentally solve problems that need to be solved. And that's what the issue I have with this. You want to go do things for theater to drive in your own primary, or you want to make a position for the general public. You've got to fundamentally answer the problem that you're supposed to be answering. Don't just posture.
Thank you, Mr. Berkowitz. Mr. Walker.
I do support the action to file legal action. However, that doesn't stop anything. That doesn't stop what we should do in healthcare. We need more doctors in Alaska. We have the largest shortage of doctors of any state in Alaska. I believe the reason we have that is because we don't have a medical school in Alaska. We sort of kind of have a medical school. You can go the first 2.5 years in Alaska in this system, and then go to the University of Washington. We pay for that as a state. We should have that in Alaska. Now that takes an economy. It takes more revenue to do that. Part of the reason we don't have enough doctors in Alaska is just because we don't have enough of the residency programs. We do bring up for residency programs in Alaska we pay for. But we should create a program that if they stay in Alaska, will help pay for the student loans. Some way that will bring more medical professionals into our state. You know, we have a great nursing program in the university system, and that's done tremendous. I mean, we've seen the shortage of nurses in Alaska go down as a result of that. We do the same thing. As much we can do in Alaska on helping the healthcare situation, that we can do it ourselves. I'm all in favor of us, but we need to address it. We can't just ignore it and say, no one's going to push us around. We need to embrace it and be part of the solution, not part of the problem.
Thank you, Mr. Walker. Mr. French.
I could talk about this for about an hour. The lawsuit is bogus. It's particularly bogus given that this governor was in office in 1993 as a state representative when this exact same idea that he objects to so much, the individual mandate, was proposed as a reaction to the Clinton health care plan. Republicans in the United States Senate filed a bill very much like the one that's now in effect that required every individual to go out and buy insurance. Ted Stevens was a co-signer under that bill. It's not a new idea. It's not a radical idea. It's how you make insurance work. You get everybody into the insurance pool. Frankly, it's not the solution I would choose. I would choose single payer. I think that's the right way to go. But frankly, we couldn't get there in this political landscape, so we chose this as a compromise, and it particularly makes me infuriated that the Republicans are fighting on this, an idea that they developed through the Heritage Foundation, Ronald Reagan's think tank. It drives me wild. I have to do Governor Parnell endorsed Mitt Romney for president in 2007, a year after Mitt Romney instituted the individual mandate in Massachusetts for its thousands of residents. Frankly, a plan that's working. I think it's a good plan. It is a good plan. I proposed a bill along those same lines. You get affordable insurance into the hands of everybody here. We've been working on that. My campaign manager back then, Andy Modrow, and I worked very, very hard to file a bill, and we've had hearings. We put up a website. HealthyAlaskans.com describes how you can get affordable health insurance into the hands of every single Alaskan that a person can afford. Again, it's not the perfect solution, but it's a way to first get folks insured. Then you have to deal with primary care. And we did that this year in a significant way through $9 million for a new neighborhood health center right here in Anchorage where people can go and see a doctor. So there are solutions out there. I'm working hard on them. I believe in healthcare. I believe in universal healthcare. And thanks for the question.
Thank you, Mr. French. Mr. Pope?
Well, one thing when you go last is most of the details are covered. I think Hollis made a lot of good points. I have a background in healthcare. I used to have a consulting practice where I put together medical groups. So I put together the Alaska Heart Institute, the Anchorage Women's Clinic, lots of different groups. I don't support the suit. It is a bogus suit. Even his Attorney General says that it's very thin foundation. But I think what the governor's really doing is pulling a play out of Sarah Palin's playbook, which was she did a $1,200 per person energy rebate or energy, something to help us with the energy a couple of years ago, bought herself an 80% approval rating. And then the next year when President Obama brought energy efficiency stimulus funds to Alaska, well, we couldn't possibly accept that. That's outrageous that, that the federal government would be involved. And this is the same thing. We don't exactly know what all this bill is going to mean yet. It's a very thick bill, and we'll have to see how it plays out. But people do deserve a basic right in health care. It's the leading cause of bankruptcy of any people in America. And if your house is on fire, you expect somebody to come along and put it out. And I don't see why we should not be able to expect that if you're sick with the greatest health care in the world, you ought to be able to get better.